Good day, fellow learners. This is your mentor, your fact check buddy, Gapuz, saying welcome to our session number 18 for our next generation NCLEX pointer. So, be one among our hundreds of thousands and passers around the world. Okay, join the Gapuz system. Let's begin by an inspirational story.
Now let's have the message from Paul Raijan Salazar, USRN from Far Eastern University, Manila, who passed the next generation NCLEX RN from the State Board of Texas. That's July 8, 2023. So here's his testimonial. To God, all the praises and honor, for he has done amazing things in my journey in passing my NCLEX exam. I am so blessed that God put me in the hands of an excellent mentor, and that is none other than Sir Ray Gapuz. Thank you. I'm so humbled with that comment. The 3-day quick fix sessions, which are perfectly designed by Sir Ray, enables me to boost my confidence in achieving my goal. Truly, a concept a day takes your NCLEX RN fears away. Ray Gapuz. Every tool that we use, 311 book, pharma book, YouTube videos, had become my weapons during the actual battle. And the core shell gave me a stamina, because without it, I may not survive. My battle stops at 150 items. To all our mentors during the weekend comprehensive classes, to the accommodating staff, to the IT guys, and to Dr. Ray Gapuz. Thank you so much. To my wife, family, and friends, thank you for all your prayers and support, and to God be all the glory. Paul Raijan Salazar, USRN. Congratulations, Paul, and thank you for the very kind words. Your testimonial is really inspiring. So I hope more and more of our colleagues will listen to your experience. Congratulations.
So the first question that you should ask yourself is, what do I need to study? Here we go. I will make this simple and short, okay? So Parkinson's disease. What are the things that I'd like you to remember for Parkinson's disease? Focus on the symptoms, but take note, you have to know the descriptive version of the signs and symptoms as presented here. Like, for example, mood changes could be the same as irritability. Overstoop posture could be described as the patient seems to be moving with the upper body faster than the lower body. That's overstoop posture. Rigid muscles or cogwheel rigidity. It's very difficult to turn cogwheel. Expressionless face or apathy. Bradykinesia or slow movement. Automatic movement loss. There's no blinking, no smiling, no arm swinging when they walk. There's also drooling or excessive salivation. And then there is dysarthria, difficulty in using the muscles of articulation. Excessively clumsy, so there's clumsiness, and they have aching muscles. Bowel and bladder incontinence, and of course, your tremors that are considered resting or pill rolling. Initially, it will just affect one hand, and then eventually both hands will be affected. And then the speech changes. Eventually, the patient's voice will be soft and monotonous. So they could be slurring too. So the monotone voice could be associated with the underlying depression that occurs in the patient. Okay? Second, remember that levodopa is the most effective drug for controlling the symptoms of Parkinson's disease. However, instruct the patient to avoid protein-containing foods like fried chicken, because that will decrease the absorption of levodopa. And the first symptoms that you will note when there is decreased absorption of levodopa is that the pill-rolling tremors will become worse. Okay? So levodopa should be administered with a low-protein diet or avoid vitamin B6. Do not confuse it with the INH, because in INH, that's your anti-TB drug, you need to administer the medication with your vitamin B6 in order to prevent peripheral neuropathy. That's for the INH. However, in levodopa, you have to instruct the patient to avoid protein-rich foods because it contains your vitamin B6 that will decrease the absorption of your levodopa. So pay particular attention to that difference. Okay. Now, levodopa is usually best taken with meals or after meals if there's GI irritation. But for best absorption, it can be taken 1 hour before meals or 2 hours after meals. Remember, you can take it after meals if there's GI irritation. Now, your frontotemporal dementia or Pick's disease, remember it affects the fronto and then the temporal area, frontal area, temporal area. So your Broca's motor speech area is affected, the part of the brain that deals with personality is affected, temporal area deals with hearing as well as comprehension. Therefore, in frontotemporal dementia, the parts of the brain that are responsible for personality, behavior, and language shrink. So therefore, the manifestations could be changes in personality, patient's behavior, and their ability to comprehend. Here we go. What are the common behavioral symptoms? Remember the code, lapse. Lack of inhibition, judgment, or empathy. So they are unable to empathize. Sometimes they walk naked because they lack inhibition. They have apathy or expressionless face or emotional blunting. Personality changes. Usually this is manifested in their inability to maintain personal hygiene. Then the lips would usually be smacking and they will have compulsive behavior. And then they will be eating inedible objects or excessive sweets. Speech and language, you have talk, calligraphic speech, aphasia, both expressive, meaning inability to find the right word to say. So you need a communication board or a picture board, such that when they need a glass of water, they just show the picture board to show what they need. Receptive aphasia is inability to understand. So talk to the patient slowly. Then loss of ability to know word meanings. So they are lost for words because they are unable to recall which appropriate word to use because they have forgotten the meanings. And then knowledge of word meaning is lost. And then, of course, you have your movement disorders. Now, this is how your frontotemporal dementia differs from Alzheimer's disease. In Alzheimer's disease, you don't have Parkinson-like symptoms. In Pick's disease, you have Parkinson-like symptoms, apart from the symptoms of dementia. Another difference is frontotemporal dementia occurs earlier than Alzheimer's, which usually manifests when the patient turns 60 and above. Another difference is a patient with Alzheimer's disease would usually have very, very poor memory that is progressive, which means once their memory becomes bad, it doesn't go back to normal levels anymore. In frontotemporal dementia, the memory loss is fluctuating. There are days in which the memory of the patient is good. There are days that it's so bad. And then the patient with Alzheimer's disease would usually get lost even in familiar environments. For example, they get lost even in their own home. Whereas a patient with frontotemporal dementia, you don't have that. So they don't get lost in familiar environments. So those are the similarities and differences between your Alzheimer's disease and Pick's disease. So in Pick's disease, you have, remember, tremors, similar to that of your Parkinson's disease, rigidity, similar to Parkinson's disease, underactive or difficulty swallowing, once again, similar to Parkinson's disease, muscle weakness and mood swings, and of course, poor muscle coordination like clumsiness, similar to Parkinson's disease. So currently, antidepressants are given in order to reduce the symptoms of frontotemporal dementia. So for a patient with frontotemporal dementia, you need to prioritize, take note, it's still a cognitive problem, so the reorientation of the patient. That's a level 1 priority. Second level priority would be promoting the patient's safety. Remember, that's in order of priority. Cognitive needs followed by safety needs. The second question is, you have to learn how to study using technology. Okay? How do you do that? You have to engage in a teaching and learning session that would allow you to use technology. Here at RA Gapuz Review System, we have our own tools published by internationally renowned companies. And our latest technology tool product is your RA Gapuz Course Shells, covering all the subject areas on the next generation NCLEX. Plus, you have a choice whether you want to have short quizzes, you want to just answer NGN questions, you want to be familiarized with standard NCLEX RN questions, and this would also give you an opportunity to focus on the things that you need to remember for your test. And of course, the third You have to be in a conducive environment that would allow you to have that real life experience. This is our Ray Gapuz NCLEX simulation room, found at the second floor of the Ray Gapuz building here in UN Avenue. And of course, our very intimate face-to-face NCLEX RN classes for the next generation IMs. Okay? So may I invite you to join us in our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. The fee is very reasonable, starts at $3,499. The fee includes, take note, review books, that's 3, the use of our Q bank, and your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, plus next generation NCLEX RN strategies by me, and of course, quick fix session. So give us a call, 0906-201-9383. So this is your mentor, your fact check buddy Ray Gapuz, saying a functional concept a day keeps your NCLEX RN fears away. So join our teaching and learning session and enjoy the class with me and pass the next generation NCLEX the easy way.